We're back at Hartner Medical Center in Alla, Louisiana for your ABC 31 Medical Minute. Chad Long is here again with us. We're continuing our discussion. He is the Director of Community Education and the Program Director for the Geriatric Unit. And what we want to talk about this segment is the exceptional outpatient program here and how it enables you to really monitor the patients.
Yes, Lola, we have what we call an IOP, stands for Intensive Outpatient Program.
Okay.
This is a less intense program, if you would, when you're on an inpatient unit. Once a patient has been discharged, we like to follow up with that patient, monitor their medications, continue to see how much progress they're making. So therefore we have an extended program that is outside the hospital, located next to the hospital. And so we monitor these patients, bring them in, we do therapeutic groups, we have a licensed social worker, we have licensed professional counselors. We run Monday through Thursday, we pick up the patients, we do 2 to 3 therapeutic groups, activity groups with the patients, really keep the patients engaged, do vital signs on the patients so we can, check and see if there's any problems. If somebody's diabetic, we do check blood sugars. Just really wrap a tight package of healthcare providers around that patient and just make sure everything is being followed up and the patient needs where they're supposed to be.
Just send them home and leave them. That's
no,
this one.
We don't do that, and it's got great benefits. One of the main benefits is getting out of the house and socializing in groups. They befriend other peers. We do individual counseling. Like I said, it's just a total socialization project that the patients benefit from.
Okay, so you really educate the patients within the hospital.
Of course.
With that. Let's get into some disease and prevention. I know you said you could talk for days on this. You want to get into like hypertension and cardiovascular disease? Yes.
As healthcare providers, when a patient's here, we always are treating in the moment. But another thing that we take a lot of responsibility here at Hartner Medical Center is teaching. You want to give patients the autonomy and independence of their own health care. If they're diabetic, teach them to look at their feet daily. Teach them to check their blood sugars before meals. All these things. If they're hypertension, of course, we try to do a smoking cessation program. Smoking is not good for hypertension, not good for cardiovascular disease. So you educate the patients and hope they make healthy choices.
Okay, that wraps up this edition of your ABC 31 Medical Minute from Hartner Medical Center in Alla, Louisiana on KLAX TV. And your ABC 31 Medical Minute from Hartner Medical Center in Alla, Louisiana on KLAX TV.
General area of dictation of what those processes are.
Okay. This has been your ABC 31 Medical Minute on KLAX TV here at Hartner Medical Center in Alla, Louisiana.